Filgrastim is a common drug for cancer patients. It is also known as Neupogen. The med class for filgrastim is a colony-stimulating factor, meaning it stimulates cells within the bone marrow to multiply. The mode of action at the nursing level is that filgrastim treats neutropenia. This colony-stimulating factor belongs to a biosimilar drug group, meaning that it takes over for the body, producing a biologically similar product when the body's immune system cannot. The job of a neutrophil is to play a role in destruction of foreign cells, providing protection to the body. The mode of action at the client level is that filgrastim is a man-made form of protein that increases the amount of white blood cells in the body. Cancer patients may be taking immune system suppressants to help the chemotherapy work better. However, this may cause the body's immune system to not function as normal, as well as have a low white blood cell count. So, our patient may need filgrastim to increase white blood cell production within his or her body. Not having the protection needed for the body's ability to attack foreign cells could prove dangerous to the body. Providing this man-made form of protection will increase the likelihood of the immune system's ability to fight off illness.
Filgrastim is indicated to reduce the amount of infections in neutropenic clients receiving anti-cancer medications with an absolute neutrophil count less than 1,000. If the client is undergoing a bone marrow transplant, then the dosage is 10 micrograms per kilogram per day. The starting dose is 5 micrograms per kilogram per day for clients receiving myelosuppressive chemotherapy, and it should be administered at least 24 hours after the infusion. It should be administered daily for up to 2 weeks until reaching an absolute neutrophil count greater than 1,000. Before administering the subcutaneous injection, you should check the expiration dates and strength of the medication. Check the color of the syringe. If it is discolored, cloudy, or has crystals in it, do not use it. Know the proper injection sites and rotate your sites after every injection. The proper sites are the subcutaneous region of the outer upper arms, 2 inches from the umbilicus, the subcutaneous region of the middle front thighs, and the love handles. Do not inject into areas that are tender, bruised, hardened, have stretch marks, or scars. Clean the area prior to the injection with an alcohol wipe and let it dry completely before the injection. Bunch the skin and then administer the medication into the subcutaneous tissue. Store the medication in the fridge, but do not freeze it and do not shake your medication. Clients taking this medication need to schedule regular follow-up appointments with their healthcare provider to monitor platelets and absolute neutrophil counts. Those on myelosuppressive therapy need to be monitored before administration and twice weekly. Those on bone marrow transplants need to be monitored 3 times weekly, and clients with severe neutropenia need to be monitored twice weekly and then once stable monthly for the first year.
Before starting filgrastim, let your healthcare provider know if you've had any previous allergic reaction to granulocyte colony stimulating factor. Common side effects and how to monitor include checking your own temperature for fever, monitoring for cough or trouble breathing, checking your own nasal mucous membranes for nosebleeds, monitoring your pain level when walking or performing other activities of daily living, as bone pain, muscle, and joint pain have been reported as well. Monitor the consistency and the frequency of your bowel movements for diarrhea or constipation. Monitor for headache. Monitor your extremities for decreased sense of touch, as numbness has also been reported. Check your skin often for itching and rash. And check the thickness of your hair before starting and throughout therapy, as thinning hair has been reported. Monitor your injection sites, as redness, swelling, bruising, itching, or lumps in the place where the medication has been injected have also been reported. Notify your healthcare provider if you feel upper left abdominal pain or shoulder pain.